Dominic Hughes, BBC News.
Well, you saw him in the piece there. Let's speak to Dr. Havel Balata, consultant respiratory physician who's been part of the initiative since 2016. Thank you for talking to us on BBC News. I mean, the figures speak for themselves. More than 5,000 cases of lung cancer have been detected. And these are people that perhaps would never have gone for screening, which just shows how innovative, how effective this has been.
Yes, good evening. Thank you for having me on. So, yeah, absolutely. The headlines today speak for themselves. The initiative has been hugely successful. And as we said there in a piece, the one of the main targets of the program is to make this available and convenient for communities which need it most.
It's kind of a simple idea, taking the screening out and sort of finding the people rather than waiting for them to come to you. So how did it all come about? Who thought of it?
Well, I think there's a few groups that have been thinking this for some time. There is research already out there. We know in lung cancer terms, those patients from the highest risk areas have historically been the least engaged, one might argue. But that's typically due to circumstances. You know, these are typically deprived areas where life can be difficult, and getting 2-3 buses across the city to the hospital isn't easy. So it was all about making it convenient. We did a lot of work in Manchester with patient advocates, families, Macmillan, etc., and that's kind of where the principle came from.
And how do you choose the areas?
So a lot of work goes into it. As we said in the piece there, you know, it's not quite a random turn up and open the door. So we use primary care data and other metrics to kind of figure out which areas we think are most in need. There's some logistical stuff. So there's a whole team behind the scene that go out and look at where, you know, you need spaces with big enough car parks or other logistical things. But really, there's sort of a chronological method to it to try and find the areas most in need.
And currently only open to current and past smokers. Is there any suggestion, because presumably other people get lung cancer as well, not just smokers?
Yes, absolutely. I mean, there's a saying, if you have lungs, you can get lung cancer. So lung cancer in never smokers is also an important topic. But like any initiative to implement this is based on evidence and research. And at the moment, there's some good data and research now from big, well-run trials that show in a certain age group with a smoking history, screening works and can save lives. So that's why at the moment it applies to those criteria. But there's a lot of research going on, looking at various tests and biomarkers to see how we can identify those at high risk of developing lung cancer who maybe have never smoked. So whilst not currently applicable, it's an area to watch, and hopefully in future we can answer that.
And the good news is this is going to be spread further now that this sort of initial trials have shown what a success it is.
Yeah, so far it's all been in England and gradually increasing. And as you said in the introduction, the ambition here is to have whole population coverage by 2030. But of course, colleagues in Scotland, Wales and Northern Ireland are also looking at how to initiate this. So hopefully now that it's mandated by the UK Screening Committee, we'll see this national over coming years.
Oh, great stuff. Dr. Havel Balata, really good to talk to you. Thank you.